Hi, this is Dr. A. Vandiveer Strait of Wilton Dental Associates in Wilton, Connecticut. Our blog is Straight Talk. Today, we're going to talk about flossing. Flossing is probably the most unpopular subject I could talk about because everybody that's watching this probably says I either hate flossing or maybe you know what I do and then you're not feeling so bad about it. But the fact is, it's been maligned and talked about like you don't need it. There's even and it's kind of crazy because the truth is the teeth have four sides, okay? And you have to clean two of them with something other than a toothbrush. In my previous blog, I mentioned the size of the tooth and that the fact that in the back of the mouth, which is the most important part, that the side that you cannot brush with your toothbrush is actually wider and bigger than the side you can brush. In addition, it may be uneven even. So there's a lot of issues with cleaning that side of the tooth. And almost all dental disease, if you look in your own mouth and your families or your friends, you'll find that most dental disease occurs between teeth because that's where people don't do a good job. So today we're going to talk about how to do a good job. Last time we talked about the brushing part, but today it's flossing. Before I start, I want to mention there's a real issue with flossing, and that is the contour of the tooth is not always nice and flat. And there's a lot of other issues about it. And we're going to have some instructional videos on this, but today we're going to talk about the generalities of flossing. I want you to understand that with your fingers, which you've all been told to do at some point, that is to brush by holding your fingers and, trying to floss, but it's fine up to about here. Beyond that, we consider it at our office to be impossible. And we've done that by testing with our microscope and also by looking in the mouth with disclosing agents. People miss because when they get in the back of the mouth, one finger is higher than the other and they miss areas. And if you miss areas, the mouth gets repopulated very quickly and you'll get disease in the areas you've missed. So in order to be more efficient, there's a number of answers, okay? So I'm going to talk about them. First of all, let's just talk about standard flossing. The best answer, in order to not have your fingers be different, is to use some kind of a holder. Now, there's a lot on the market, but we have found that most of them, again, don't work so great. They're either hard to use, they don't hold the floss, some of them are preloaded, but the floss isn't tight enough, or the arms are too short, whatever. We have found this floss is called a floss aid, which we give away to our patients for free, and which has a big advantage because we can make this as tight as we want by pushing the ends together when we're loading it, by going around this end several times, usually 3, and then going around here with the floss and then back and then 5 or 6 times so it won't slip. Because again, you need to maintain this floss very tightly. Now, if you do this, it makes this product really work well. They're available. We have places you can buy them online, the floss aid. We do have them in our offices. If you have questions on where to get them, we can definitely help you. You can call us. But basically, it's used with 2 hands, and we're going to have instructional videos on how to do this. But if you start using this quickly, I can floss faster than I can brush. Many of my patients tell me flossing is no longer a big deal. But part of it is not only the holder, but also the type of floss you use. So let's talk about that. Okay. We tell you whatever floss works, of course, is the most important thing. Quite honestly, I find that the wax floss is the easiest, and that although there is unwaxed, which is probably cleans better, for a lot of people, unless their teeth are smooth, it shreds too easily. Also, there's ones that go through very easily. Teflon, there's ones called Glide, there's a lot of other types of non-shredding floss. And if you have rough teeth or something, obviously that would work better. However, it doesn't clean as well, so there's a trade-off. I prefer if the floss that's using traditional waxed or nylon floss to clean your teeth is shredding, that the dentist should smooth those surfaces. In our office, we would smooth them or polish them so that doesn't happen anymore. Also, it's how you do it. When you put it through the contact, you go sideways to get through. Then you go up and down on each of the 2 teeth adjacently. We instruct everyone here, our hygienist will spend whatever time it takes to get the person to be efficient and effective with this. And you can have that too. I look forward to seeing you in the future. I don't think there's a lot more to talk about with flossing. I just want to remind you that it's part of a system. That is, you have to brush, you have to floss, you have to use an irrigation device to rinse away what you've flossed loose. You've packed that down under your gum, and what the brush has done as well. And then you're going to have to use some kind of an antibacterial to kill the bacteria that are remaining on the roots. If you do that, you will stop all dental disease for the rest of your life. And that's really the goal, isn't it? So, if for more information, go to our website at wiltondentalassociates.com. That's wiltondentalassociates.com, or call our office at 203-761-0223. Thank you for watching. Next time, we're going to talk about the irrigation devices and so forth. How do you clean? There's also will be more information on alternative techniques, which we have a lot of. So anyway, I hope that you've enjoyed this and you've gotten some information from it. Please watch our future blogs and previous ones, and we'll look forward to seeing you soon. Take care, have a great day, and thank you for watching.